of cases in the country. Pune, Nagpur, Thane, Mumbai, Bengaluru urban, Ernakulam, Amravati, Jalgaon, Nasik, Aurangabad. So you will see that out of these 10 districts, 8 are in Maharashtra, 1 is in Karnataka, and 1 is in Kerala. As we said, that there is a rise in active cases. The active cases had declined as low as 1,35,000 that we are showing the trough in the graph. This happened on 12th of February. So they had come down to 1,35,000 odd cases, and today they are 1,89,000. However, what this graph does not tell you is that on 18th of September 2020, the country had more than 10 lakh active cases. So from 10 lakh, we came down to 2,54,000, 1st of January. Then we further came down to 1,35,000. And now there is this increase, which has taken the active cases to 1,89,000. So what is happening in the states? Month on month, this is a comparison between 11th of February and 11th of March. In Kerala, the number of active cases on 11th of February was 64,000. Today, they have declined to 35,000. So this is a fact that we tend to lose sight of. When we say that total number of cases are 1,89,000, then we say which states have the highest number of cases, and then Kerala gets clubbed with all the states which are contributing those 1,89,000 cases. We need to appreciate the fact that in a month, from a high of 64,000 plus active cases on 11th of February, Kerala has come down to 35,700,000 odd cases on 11th of March. Similarly, in Uttar Pradesh, from 3,200 active cases a month ago, today we have 1,600 active cases. That is also a credit-worthy performance. In West Bengal, from 4,300, we have come down to 3,100, which is a decrease of roughly 1,000 plus, lesser than Uttar Pradesh and Kerala, but still significant. Then which are the states which are showing a rise? Maharashtra. On 11th of February, Maharashtra had 36,917 cases. Today, they are more than a lakh active cases. Punjab had 2,100. Today, Punjab is touching 9,400. And similarly, Madhya Pradesh, Gujarat, and Haryana are the states which we think are at a tipping point. They have still yet to decline into a surge. However, looking at early signs of increase in numbers, we have had 3 meetings at the level of the Union Ministry of Health and Family Welfare, at the level of the Cabinet Secretary, and at the level of Principal Secretary to Honorable PM, where the states have been told that they need to pull up their socks, increase the number of tests, increase surveillance, increase containment areas. Basically, whatever we have been doing so far, so it is more of the same, but more of the same in a more efficient manner. So that is our message to the states. Daily new deaths, this is 7-day moving average, they remain low in spite of a surge in cases. So this we have shown from January, when it was almost 160 deaths on an average in a day. Now it is 108. It had declined to less than 100, and it has marginally climbed. So what is happening in the vaccination space? These figures are early morning today. We are saying 1 p.m. because we are meeting with you at 4. So 2,56 lakh doses have been administered across the country, and we have given you the disaggregated data of how many 60 years and plus, how many healthcare workers first dose, how many healthcare workers second dose, how many frontline workers first and second dose. Now this is a comparison which is quite interesting. Till yesterday, we had completed 53 days of vaccine administration in India. So we are giving you figures from our world in data, not our website, international website, of the first 53 days performance of all countries. So US in the first 53 days, and please remember, which is not shown here in the slide, that United States of America started their vaccination on 14th of December, more than a month prior to our start, which was on 16th of January. So US has had administered 3 crore 68 lakh vaccine doses in the first 53 days. What is their number today? We will show you in course of this presentation. India in the first 53 days, 2 crore 56 lakh. Brazil, 1 crore 13 lakh. Brazil is important because they started a day after we did. We started our vaccination on 16th of January. Brazil started it on 17th of January. Turkey has done 1 crore. UK, they started their vaccination on 8th of December. Even before USA started the COVID-19 vaccination, UK had started. And their figure in first 53 days was 94 lakhs. They have picked up subsequently. There are other countries also in the slide. I would not dwell on them because most of these numbers are shared with you. What is the cumulative number today? As we talk to you, again this is from our world in data. When we talk to you today, United States of America has done 9 crore 36 lakh vaccinations. India has done 2 crore 43 lakh vaccinations. This number has obviously increased. United Kingdom has done 2 crore 37 lakh vaccinations. Brazil has done 1 crore, and so on and so forth. So we have shown you what was the performance of all countries of the world in the first 53 days and what is the performance of all countries of the world today in COVID-19 vaccination. This, I think, addresses the question that we have not ramped up sufficiently. In fact, from 4th of March, when we did 10 lakh vaccinations in 24 hours, on 8th of March, in 4 days, we achieved 20 lakh vaccinations in 24 hours. So if that is not acceleration, then what is? This is very important. Acceleration has been achieved with active collaboration of private sector facilities. So if we look at this 2.5 crore doses which have been administered in our country till date, you will find that 71% of these doses have been administered in public health facilities. These are government hospitals. They could be PHCs, they could be health sub-centers, CHCs, subdivisional hospitals, district hospitals, medical college hospitals, so on and so forth. And 28.77, almost 29%, has been contributed by private facilities. So which are these private facilities? They are all private hospitals which are empaneled in Ayushman Bharat Pradhan Mantri Jan Arogya Yojana. They are also all the private hospitals which are empaneled under Central Government Health Scheme, CGHS. They are also all the private hospitals that are empaneled under state government's health insurance schemes. These are state government's own schemes. In addition, in Odisha, in Delhi, in Telangana, in Maharashtra, they also include such private facilities which are not covered in the earlier 3 categories that I just explained to you. And based on specific recommendation of the state governments, we have permitted those facilities also because they have adequate number of space, adequate number of cold chain, adequate number of vaccinators, and adequate arrangement to address adverse events following immunization. So therefore, our doors are open to all private facilities We have made our system so flexible that those private facilities which have the capacity, they can do COVID-19 vaccination 24 hours, all 7 days of the week. Whereas for state government hospitals, the advice is that they should do it minimum 4 days in a week. Why? Because they have to do other work also. They cannot shut their door to non-COVID essential health services and do only COVID vaccination. So therefore, public facilities do it minimum 4 days in a week, maximum they also do it 6 days a week, whereas private hospitals have been given the leeway to do it 7 days a week, 24/7, depending on assessment of their capacities that is done by the state government. Okay, so when we say 28.77% doses have been administered in private facilities, which are the states which are logging a performance which is below the national average in terms of participation of health facilities, private health facilities? They are Andaman and Nicobar, which is understandable. It does not have private hospitals. Lakshadweep, which is again understandable, Arunachal Pradesh, then Sikkim, where private hospitals account for 7.8%, Tripura, Himachal Pradesh, Ladakh, West Bengal 13%, Bihar 16%, Jharkhand 17%, Andhra Pradesh 18%, Rajasthan 18%, Assam 20%, Chhattisgarh 20%, Odisha 20%, Meghalaya 21%, and Gujarat almost 25%. So these are states where we have requested that the participation of the private sector hospitals need to be scaled up. Okay, so this is something that we share with you on a regular basis. So today there are 13 states and UTs which have given second dose to more than 80% of all eligible healthcare workers. There are 2, Daman and Diu and Nagaland, which have achieved 100% coverage. There are 8 states and UTs which have administered second dose to more than 60% of the eligible frontline workers. Here also, Puducherry has done 100, and there are others who are between 60 and 100. Some of our colleagues had said that we are no longer sharing the adverse event following immunization. We were not sharing this data because this was so minuscule that it is absolutely insignificant. But since you had demanded, so here we are. AEFIs which have been reported so far are 0.020% of the total immunizations which have been done. Hospitalization, they are 0.00025%. This is almost a surrogate for 0. So, but we thought that this must also be brought in the public domain. I thank you for your patience.
Dr. Paul will give his comments.
Thank you. We have an update both on the pandemic situation as well as on scale up of the vaccine. I'd like to make 3 points. Firstly, you have noticed over the last 10 days since we met last, there is a very clear-cut, very impressive speeding up of the vaccination program. You saw the data and you have seen how through the participation of public and the private sector both working as one system, the nation has enhanced vaccine coverage phenomenally. And as we move along, we will build this momentum further, keeping in mind the equity that it should reach everybody, nobody should be left behind, and keeping in mind also the available stockpile of the vaccine. So the speed is now out there. Do keep in mind that the liberalization in terms of private sector engagement has now gone to the, in a way, maximum possible extent. Vaccines can be taken anytime. Practically everybody, every private facility can be a part and parcel of this national movement. That is the first point. The second point is the good news that you all know that Covaxin is now in regular emergency use authorization. And our terminology for this is that it is now allowed for restricted use in emergency situation in public interest. And this has taken the authorization for Covaxin to the next level, the same level at which our other great vaccine, Covishield, has been operating. You are aware that back in January, a decision was taken to allow its restricted use, but there was a condition for abundant precaution, in the interest of abundant precaution, that we will scale it up in a clinical research mode or a research cohort mode, and that's how the scale up was happening. Now that restriction, that condition is now no more there. Both the vaccines now have the same level and same intensity of the licensure backup. The same licensure now applies to both the vaccines, so therefore it's a great day. This vaccine, as you know, has already been given to more than 19 lakh people, and it has stood the test of time in terms of great safety. Only 311 individuals had some minimal side effects. So this is a great news for the day. It is a triumph of India's research and development enterprise, science and technology enterprise, as well as our industry, and I congratulate the team in the laboratories of the Indian Council of Medical Research, led by Dr. Bhargav himself, and of course the Bharat Biotech industry, which has ensured that the vaccine candidate was taken through all the stages of its development, all the difficult stages of development in the laboratory, in the animal laboratories, and then out in the field, where more than 25,000 individuals were randomized to receive the vaccine or the placebo. It's great work having been done by them. The further trial, phase 3, goes on, like for the other vaccines in the world as well as in India, but it is a great milestone on this day. The third point that I wish to make is a matter of concern. Rajesh Bhushan ji has graphically demonstrated to you where the states where we have significant worry. We are very worried about Maharashtra. Across several districts of Maharashtra, you saw their names. And as we came in, we learned that there is a strict lockdown being imposed in Nagpur in particular. So we are reaching a situation where those approaches are being brought back. It's a very serious matter. It has two lessons for us. One, don't take the virus for granted. It can come up unexpectedly. It can come up when its own dynamics, part of which we don't know, favor the virus. And it also tells us that if we have to remain free of this virus with time, it is very important that all our armamentarium, COVID-appropriate behavior, containment strategy, readiness from the health system point of view, our facilities, and so on and so forth, as well as vaccination today, has to be brought into facing this pandemic and the virus in full ballast. For example, it will be our suggestion that in districts, in all the states where the virus is seemingly on the rise in a significant way, the vaccination of the eligible individuals in those areas should be intensified, should be prioritized, in fact. That will be our advice. I also want to bring in here a word of caution for the Delhi and neighborhood, that Delhi is also seeing somewhat of a rise, somewhat of increase in positivity rate. So also in Gurgaon, Faridabad, as well as to an extent in Gautam Budh Nagar and Ghaziabad. Be careful, be watchful. We still have a huge population at risk of this virus. This pandemic is not yet over. Until it is fully over, it is not over. And therefore, be vigilant. And today, using the force of vaccination, we are in a position to give a fight which is stronger than the fight that we gave thus far. So we plead yet again to all of us, all the the individuals here as well as those who are listening to us, do not lower your guard. Do not take this virus for granted. At the same time, please embrace the vaccines that are available. Please, if you are eligible, we want to cover you the fastest possible way. There are flexible modes of receiving the vaccine, which are now being appreciated by one and all. Keep in mind that there is a full partnership of the entire health sector out here in our journey, in our mission to control this pandemic. Thank you very much. I once again want to congratulate National Institute of Virology, Indian Council of Medical Research, and all the scientists who worked on this vaccine now, which is now ready, which has now reached a very distinct and a very, very laudable level of licensure. And we look forward to escalating the production of this vaccine even as we are spreading its usage and utilization by vaccinating the people. Sir, I'd like you to say a few words how your scientists worked on this journey, because they deserve all our appreciation. We are very proud.
Thank you, sir. I think it's a great day again today that we have got licensure for emergency use. And this is great for a vaccine which has been developed in less than 1 year's time. The first case of COVID-19 in India was on 30th of January, and the vaccine was rolled out on the 16th of January. So I congratulate, through you people, congratulate the entire scientific community of the country, the entire healthcare community of the community, as well as all Indians at large. Thank you so much.
Thank you, sir, for clarifying the position on Bharat Biotech's Covaxin vaccine, which is a great success for the indigenous pharmaceutical industry. Now, if there are any questions, number 9. Number 9.
So my question to you is regarding the pace of vaccinations. On Monday, we recorded over 20 lakh vaccinations, while in the last 2 days, it has been around 13 lakh. Suddenly, there's a major drop. While it's commendable that we had 20 lakh on Monday, but I'm sure the ministry is aiming at a consistency. So do we know the reason behind the sudden drop? Is it because certain states do not vaccinate on certain days, or any particular reason?
Well, you have answered your question. What we are looking at is a steady increase. We are not trying to win a race. There are no gold medals to be won. So by doing 20 lakh vaccinations, we have demonstrated that we have the capacity to do 20 lakhs. As I told you, private hospitals do it for greater number of days in a week, for greater duration, and states have been given the leeway, the discretion, because at the end of the day, health remains a state subject. Let's not forget that. And we need not want to impede or adversely impact the non-COVID essential health services which are delivered by the same hospitals which are doing vaccination. And incidentally, this is just a quibble, yesterday we were 13 lakh 17,000, we were not 13 lakh, day before we were 13 lakh 70,000. Thank you.
104.
डीडी न्यूज़ से शुरुआत में सर जब हेल्थ केयर वर्कर फ्रंट लाइन वर्कर का जब डाटा आता था तो उसमें एडवर्स इफेक्ट के आंकड़े दिए जाते थे. जब बुजुर्गों का शुरू हुआ 60 साल से 45 साल से अधिक उम्र के, तो उनमें कोई डाटा नहीं आता. तो क्या ये मान के चलें कि साइड इफेक्ट नहीं हो रहा है या एडवर्स इफेक्ट नहीं हो रहा है? दूसरा सवाल इसमें मेरा है कि
2 सवाल तो सामान्यतः लोग नहीं पूछते हैं, लेकिन इसमें मैं प्रारंभ कर देता हूँ, फिर डॉक्टर पॉल बताएंगे. अभी तक का आपका जो ग्रीवांस था और जस्टिफाइड था कि आपने 3-4 हफ्तों से ये परसेंटेजेस दिखाने बंद कर दिए, तो अब हम आज आपको दिखा रहे हैं. आज आपने एक नया सुझाव दिया है, अगली बार हम वो भी आपको दिखा देंगे. डॉक्टर पॉल बताना चाहेंगे एज अप्रोप्रिएट वैक्सीनेशन.
उसकी भी ब्रेकअप दिखाया जा सकता है, बट बेसिकली आप देखिए बिग पिक्चर ही लेके अभी सबसे सामने शेयर किया है. And the big picture is, as you know, is reassuring, it is heartwarming, and this will be escalated quickly. We want the senior citizens who are now eligible to please take the vaccine quickly, because when we will add other groups, फिर थोड़ा rush भी बढ़ेगा. तो एक प्रैक्टिकल भी सजेशन यही है कि अब आपकी बारी है, आप प्लीज़ इसको लीजिए और इस बात को बढ़ाइए, और हर दर्जे के, हर तरह के परिवारों को में जो हमारे साथ से ऊपर हमारे भाई बहन हैं, उनको हम कहते हैं कि अब इस मौके का आप इस्तेमाल करिए।
Number 16.
I just wanted to know, is the government buying Covishield at a renegotiated price of rupees 157.5 per dose from the earlier 210? Is it inclusive of taxes? Also, is there a price renegotiation with Bharat Biotech's Covaxin as well?
The earlier price was 200 rupees per dose, and if you add taxes, then it became 210. We had shared disaggregated data of the earlier price in one of these interactions with you. It must be there somewhere in the archives of PIB. After that, we have renegotiated the price. The renegotiated price is significantly lower than 200 rupees per dose.
Number 15.
So I wanted to know about the action plan for Maharashtra. Teams are there, they have been there for over a month. What is the feedback that you are getting? What is the role of the mutant strain that we found there? Is there any connection established in that part?
Mutant strain.
Maharashtra has shown worrisome trend, and the mutant strain has not, and I repeat, not been found incriminating in this surge. It is just related, at the moment we are very clear it is related to the reduced number of testing and tracking and tracing, as well as COVID inappropriate behavior and large congregations and masses that have accumulated at places. That is responsible for the surge in Maharashtra, and we would appreciate the continuation of the measures, all the COVID appropriate behavior, and it has also been incriminated that certain suburban trains were responsible, marriage season. So all these kind of hypotheses are there. However, it is definitely not related to the mutant strains.
Number 20.
The vaccination drive has picked up pace, no doubt. Does the government have a timeline in mind for phase 3, and who gets included in that?
As we said, we are now focused on the relatively large group of individuals above the age of 60, as well as those up to the age of 45 but comorbidities. We are building up momentum to cover this significantly large group. We will see the progress, and moving forward, yes, further increase in the circle of those who are eligible will be considered.
24.
सर, हाल ही में राजस्थान सरकार की तरफ से जो कहा गया कि वैक्सीन कम आए हैं, केंद्र सरकार स्वास्थ्य मंत्रालय के जो आंकड़े थे वो कहा गया कि पूरे वैक्सीन दिया गया, करीब 36 लाख का आंकड़ा स्वास्थ्य मंत्रालय की तरफ से दिया गया। तो ये जो आंकड़ों का अंतर है दोनों के बीच का, क्या ऐसा तो नहीं कि कुछ वैक्सीन जो हैं वो पहुंचे नहीं हैं, या क्या इस मामले को राजस्थान सरकार के साथ मिलकर कोई इन्वेस्टिगेशन किया गया है या किया जा रहा है?
प्रत्येक राज्य को कितने वैक्सीन डोजेज किस वैक्सीन के दिए जाते हैं, उनका क्या कंजम्पशन होता है और उसके बाद क्या बैलेंस बचता है, इसकी मॉनिटरिंग स्वास्थ्य मंत्रालय दैनिक आधार पर करता है। रोज सुबह 9 बजे डॉक्टर मनोहर अगनानी's डिवीजन gets it online from the states. This is very important. This data comes from the states. क्योंकि वैक्सीन का इस्तेमाल का उपयोग का कंजम्पशन तो स्टेट्स कर रहे हैं, भारत सरकार तो टीके लगाती नहीं है। हम तो केवल वैक्सीन उपलब्ध करा रहे हैं, जो सरकारी फैसिलिटीज़ हैं वहाँ निःशुल्क उपलब्ध करा रहे हैं, जो प्राइवेट फैसिलिटीज़ हैं वहाँ एक चार्ज है जिसकी जानकारी आपको है। तो प्रतिदिन हम इसकी समीक्षा करते हैं। हमारी समीक्षा के आधार पर आज सुबह के आंकड़ों के हिसाब पर भी और आज से 3 दिन पहले भी देश के किसी भी राज्य में वैक्सीन की कमी नहीं थी, और हमने ये जानकारी जो राज्य सरकार के हमारे काउंटर पार्ट्स हैं उनके साथ साझा भी कर दी थी।
116.
Good evening. I would just like to know how many more vaccine doses are we procuring? If you could just give a breakup between the two. Thank you.
That is something that we would not want to address because this is a matter, procurement and manufacturing, which is under consideration in Honorable High Court Delhi and Honorable Supreme Court Delhi, Honorable Supreme Court of India.
Number 10.
How many post-vaccination deaths have been reported since the start of the vaccinations on 16 January and since the start of this second phase? And how many of them have been causally linked to vaccines?
So, causal linkage, as far as the national committee has set up, they have met once and they are going to sit again. And they have concluded evidence only the 2 cases, they have the information. There is no causal relationship on that. Causal relation is not established, but they are doing more on the further cases which have been occurred in many states.
How many deaths, sir? We will share this
We'll
data
share
with
this
you.
data.
Thank you.
Thank you. Thank you very much.